set up a system to where patients could come completely free of charge and really building on that model of being a free clinic with a lot of nonprofits. There's a saying of no money, no mission. And you have to strike that balance. How are we taking care of the people that are providing this care and not looking at the fact that we're actually being held back by not keeping an eye on these metrics?
We appreciate you joining us today, and I really wanted you to start by telling us about Mercy Health Clinic.
Yeah, absolutely, Ted, and thank you. So like a lot of organizations, we were started by a faith group, and they had finished a capital campaign and were way ahead of schedule in the funds they raised, and they felt that they should do something that would create a positive legacy for the community, and they did a second fundraising campaign and came up with seed funds that led to this idea of how do we achieve this vision? What is this legacy that we do? So Our Lady of Mercy was the founding parish there in Potomac, and that's where our name comes from. So what they had got together was the committee came together led by community members and a nurse. And she had worked with several physicians that were starting to retire, and they were talking about this idea of how they're trying to provide this care out of their offices for people that were uninsured. And it felt very fragmented, and they were frustrated, and they thought, how great would it be if if physicians had a place that we could go and create a purely free clinic where we could come in and give our time and provide the care that we were doing in a very fragmented sense in our offices and doing it rather ineffective. So the idea stuck, and then shortly thereafter, as we said, we were founded in 2000. The model was very doctor-centric. It was created in this idea of how can we take this vision that we've been thinking about, in some cases 50 years in their career, and set up a system to where patients could come completely free of charge and really building on that model of being a free clinic. When the county, there were people doing work like this, but not really under that free clinic model. And then that really continued until about 2015. And today, and we were always a non-sectarian, nonprofit organization, like any other 501c3. But really, to that point in 2015, which I'll get to later, is that that really brought us to who we are today. So now we are a patient-centered medical home. We see adolescent patients as well, which up until our history until 2021, we had only seen adults. And we now take insurance as well. So it's the same population. We still are predominantly seeing uninsured patients. As some of these patients are able to become insured, it's still a very low-income population. So all of our patients are what people call the working poor. So about 96% have a job, but all are about 250% below the federal poverty level. But just to say, for perspective, like an individual will be, our average patient, if an individual is probably making about $21,000 to $27,000 a year on the top end.
And when did you join Mercy Health Clinic?
In 2015, and then as the remark said, it was about 2 years after you had come on as well.
Right. And so what did the board tell you at the time when you joined Mercy Health Clinic?
Well, that's a good one, because in our transition, that was about, when I said that 2015 mark, the clinic had gone through a lot of change. One, we had been through about 5 years of deficits running through a reserve fund. And I was, I think, partially hired because I had a background in fundraising. So I had spent at that point probably maybe 18 years or so doing program building and fundraising. So they said they thought that this was a fundraising problem. And when I first came on board, there was challenges, staffing. The Affordable Care Act had recently come in, making the clinic go through things like adding a medical record, which upset the original founding. So there was a lot of change was still going on, but it was pretty turbulent. When they came in, they said, here are some of the challenges. And when I was looking around, there were some challenges, but things weren't adding up. So I had pages and pages of questions, and so I looked to our data.
And so, like, if I recall back then, there was a deficit that you had to deal on an annual basis, and the board had information about that financial deficit, and they had a certain idea that was not supported by the data. What was that? What was the difference between what the financial data was telling them and what they thought?
Yeah, as I was coming up with these questions and looking for answers, I pulled back trend data on patient visits, on earned revenue, which even in a good year back then, we still have to fundraise about, even now, 55% of what it takes for our operating budget. Back then, it was closer to 58, 59%. And I noticed in the trend years that when we were having to fundraise more of that, it was directly related to lower patient counts. Also, looking at staffing costs. So I saw saw that our staffing costs were rising significantly at the same time that our visits and utilization was plummeting, and it didn't feel like it was a fundraising problem. Our fundraising was solid. It was increasing year over year, doing what it was supposed to do. And to me, I thought, okay, we had it wrong.
So the board had ideas about what the problem was, and then you dug into the operational information. The operational data was telling you that the fundraising was actually ahead of best practice, right?
Yeah, absolutely. And I think with that, then opened that those floodgates of questions and looking for answers and coming up with models. And what I think is interesting, when you mentioned at the bottom of one of your last slides the number, that's when I found that number for me. What that was looking at one of the things is when I mentioned how this was designed in the beginning as being a free clinic, there was a fierce protection of wanting to keep that part of the mission, and then me having to go and change, putting in elements that would make us more like a business. For instance, we didn't have all the boring things that you would look at in a business were essential there, because I couldn't figure out what our staffing levels needed to be because we didn't have set appointment blocks. So our medical director at that time had come in not long after me. I had a lot of questions and she had a lot of answers, and we came up with looking at where to start. Getting that high level answer brought us into where we needed to seek data at each point. And one of those was the first thing we needed to do was run it like a clinic in a business. So we put in appointment blocks, which helped us figure out provider efficiency. We tracked time. All of those things were setting that foundation to where we are now.
And so when you look at this graph here, what is this graph telling us and the audience here?
Well, a lot of it is about efficiency, earned revenue. One of the things we look at is for our core part of the population, which is 600 patient encounters, what we're looking at for a month. Now, that's only a small portion of the work we do and all of the output. But some of that, when I'm looking at these trends, the first thing I look at is that number and see where we fall. And then that helps me understand that core part of that earned revenue. And so when we're looking at trends like this, so for instance, it can let me know at any given point, did I have a staffing turnover issue? Is it a performance in terms of patient visits that we're getting? And then once I figure out that question, then it gives me direction to go to that next data point. Is it because I had my volunteer corps, some of my volunteer doctors called out? Do I have turnover in paid staff? Or are the patients not seeking visits? Are there things that we can do follow-ups? Each one of those data points, when I'm looking at a trend like this, gives me an idea from that higher level performance of where to go next and to find out what's going right and what might need correction in real time.
So the board was looking at things from a big picture financial perspective. You got in there, you looked at the actual data. This shows some real improvement. When you look at the revenue per patient served, that shows real improvement during the period of time you changed that operational efficiency. How would this have affected or impacted your decision making, and how would you use this information if you could go back and had access to this information during that same period of time? How would it have benefited?
Well, it certainly would have sped up the process of figuring out what was wrong.
Right.
And I think with a lot of nonprofits, there's a saying of no money, no mission, and you have to strike that balance. And I think back then it's all about the mission, the volunteers, and what how are we taking care of the people that are providing this care, and not looking at the fact that we're actually being held back by not keeping an eye on these metrics. So I think back then it would have sped up that point of the orientation needed for us to be who we are now.
And one of the great things that we talked about was that while the revenue is going up per patient, that was really funding a lot of the mission of the organization. What was the benefit to the mission of the organization by the additional funding that you got per patient?
Yeah, so one of the biggest, I would say, preemptive pushbacks that we were getting from our founders was, are we going to change who we are? Are we going to stop being based on this free clinic model? And so the challenge I had, and I felt strongly about, is I wanted to not take away anything that made us who we were. So how can we add the business aspect, but still do the free clinic elements that we had? So for instance, we still don't charge a copay. We'll request a donation. So to answer your question, it's little things like that we were founded to create access largely for uninsured patients that cost would be a barrier to care. So how can we make ourselves more sophisticated while, say for instance, we get a lot of pro bono services from the community. Adventist Healthcare donates almost 100% of our labs. So there's one lab service they don't. So being efficient in these numbers let us do these altruistic things like absorb the care of that one lab for our patients. We don't have to pass that one specific study to them. So it's really allowing us to do these things that have really strong benefit for the community. For instance, like if we're a comprehensive healthcare provider, so we're doing cancer screenings. And if you're doing cancer screenings, you have to provide surgical procedures when you find cancer. And that goes all across the board on everything we do, nutrition education. Some of that needs food access. So being efficient in these areas and operating in a way that allows us to reinvest in our employees and then build a reserve fund and do all the things we're supposed to be doing as a business and as a nonprofit business, it allows us to have money to think strategically and expand, such as seeing adolescent patients, which we did in 2020.
So on this next slide, first slide was pre-COVID. Now, COVID hit and all bets were off, right? What changed because of COVID for you?
Oh, well, funding structure for one did as well. We had to pivot in our business, and I think one of the things what I talked about in the beginning is looking at numbers, looking at trends. I probably, because we have limited time, I didn't talk nearly as much about the impact that the external environment and policy has on probably all businesses, but that really became present too. So we had to pivot and what patient need was, concerns about protecting staff. The workforce was mentioned throughout this several times. The healthcare workforce in terms of cost, availability, and the type of work and environments they want to work in all change. So we had to adjust to that. And then to answer, as we're looking at this, right there at 2020, the final quarters of 2023 was really us pivoting back to an operating structure that was based on encounter-based reimbursement. So as we're looking during the pandemic, we were doing a lot of follow-up care. We had a significant number of patients that were still hospitalized that we were providing telehealth and support care to that was very different, that we had never provided so much off-site care. And then as we're transitioning back to the work we were doing prior to that, those numbers are really showing us looking at getting back to our staff efficiencies on individual patient appointments. And then those numbers also impact how we're adjusting staffing now.
And so that's a pretty dramatic change in the business. Walking into a board meeting and knowing that this change happened, like, how is that going to help you prepare for that board meeting?
Well, that's the part of it too, is that when we go back to 2015, that was a hard sell. And, if any of us could do things differently, I would have had a fancier presentation and a better, I was really just immersed in figuring out these numbers and having these aha moments and probably looked more like a mad scientist of throwing all these numbers at them at this board meeting. But really what it is I use probably the entirety of our financial package. I mean, I need to know what I'm talking about when I'm in there with them. And when they ask me questions, I try to be prepared of explaining and knowing, not just explaining what this number means, but how we got there. And trying to make sure that, for me, that these are intentional decisions. And when they're not, we learn from them, and we sometimes use those because they're better. But a lot of things, it's really understanding, one, that core number, but really how all of our individual metrics are informing some of our growth in this area, and then back the other way. What does this trend say about how I may project, or what hiring I can do in the next quarter?
And so, once you really understand, your key number, and then you start to see changes happening in that key number, what does that cause you to do?
Yeah, I think that goes back to one of the other items I had said before, is that, so when I see that number go up or down significantly, that lets me know where to go next with data. And with us, we have probably about 3 or 4 high-level financial numbers we look at, and that one being an output of patient visits helps me project that number for income. But the other is that, so for instance, if I'm seeing that number dip, that's where it allows me to go back and see, is it a capacity concern? Is it a staffing issue? Is it a blip? Is there a historic trend? And it helps me narrow down, because if I was looking at 50 different data points, which easily were probably covered by all of that, it would be overwhelming and I wouldn't be productive. So it's finding those indicators that help me figure out where to go next.
That level of understanding, and does that give you more confidence in going into the board meeting?
Yeah, absolutely. I mean, I'm not always right. I mean, let's just say it doesn't always land.
Right.
But what we're doing now is we're focused on growth in our mission. And so when I talk about that, when the talk was about the mission in 2015, and we were very protective of that mission, we were doing less of it. Right. So now, as we're in the board, we're all completely aligned on this, and back to that no money, no mission, the better we're doing financially, we're not worried about going out of business in 3 years, where we were at that point. If we couldn't figure out what we were doing with our reserves, we were at a real point of being out of business in 3 years at the rate we were running through with those deficits. So I think now they look at it as it's exciting because it can be stressful. We still have to do 50-something% of fundraising to keep the lights on, to pay staff to do that work. But we're seeing by looking at our numbers and our trends and remaining to be financially healthy and keeping on top of it ongoing, monthly and then our quarterly reporting, it allows us to expand to, say, adding adolescent patient in 2021, taking on new projects where we're doing testing and partnerships with NIH for really that expand into global health initiative. These really excite the board, and then you've got an organization that's aligned around the growth of the clinic, but we never take our eyes off the financial side.
And you built up a good reserve, and now because of the information you have, what are you thinking about doing with that reserve?
Well, and the timing's great. So we launched a strategic plan at a board meeting in February of 2020, and then everything changed. So it was March of 2020, so everything changed. But we completed that strategic plan against all the odds and the things tipping against our favor in that. We had the plan to add adolescent patients. So now we're looking at this. We checked off all the boxes, which is rare to do that in a strategic plan, but we used it. It guided us, and that's where we are now. That we're, for the first time, we're sitting on a reserve fund that we built back up, and we're looking at what is next. What does the community need? What needs have changed with our patient? How can we keep a better eye on global and population health? Because so many of our patients are recent immigrants from across the globe. It's really giving us such an incredible opportunity to look now at what we've grown, where we've grown from and where we are. And it might not be that we need $1 million reserve now. We did then, but we also now, because we're keeping track of metrics on a constant basis and making incremental adjustments, sometimes monthly, not quarterly, we can rethink of maybe it's a smaller, we're looking at, say, a 3 to 6 month reserve, and then we reinvest in potentially a second location, or looking at health where we can get out into the community. There's so many options that we're discussing now.
And for us, we're honored to be part of supporting the mission, helping it expand, helping you make those additional investments, giving you the confidence for that. And we really just value our partnership and look forward to helping you continue to grow to the next level.
Well, thank you, and I appreciate this opportunity to talk.
Great.
Thanks, Ed.